Welcome to Banega Swasth India podcast. Our focus this season is One Health, One Planet, One Future. Our aim is health for all and leaving no one behind, because only a Swasth Bharat can be a Sampann Bharat. I'm Ambika Singh Kama, and today, as we mark World Health Day with the theme Our Planet, Our Health, that aims to draw attention on the urgent actions needed to keep humans and the planet healthy, we will be talking to Dr. Regi George and Dr. Lalitha Regi, trustees of the Tribal Health Initiative. The doctor couple have transformed the health of the tribal community in Tamil Nadu, Sittilingi Valley and the surrounding mountains in the last 29 years by a variety of programs in healthcare, community health and farming. The couple started the Tribal Health Initiative in 1992 with Sittilingi's first hospital-cum-patient unit from a small hut with a dream to provide affordable basic healthcare services to the people. Today, the Tribal Health Initiative has spread to over 33 villages in the Sittilingi Valley and benefits more than 1 lakh people. Joining us first on this special episode is Dr. Lalitha Regi. She talks about the journey so far for the initiative and what made the doctor couple leave everything behind and move to Sittilingi Valley in Tamil Nadu.
We, Regi and I, we had this dream of working in an area individually from our childhood. So we knew that tribal areas all over India are geographically isolated and they need a lot of healthcare facilities. They lack a lot of healthcare facilities. So we looked at the health statistics, whatever was available at that point in time, and the studies, and shortlisted 3 places in tribal areas in Tamil Nadu, which were furthest from a healthcare facility. And Sittilingi happened to be one of them. We listened to the people and we realized that there is a need. We decided to stay on.
Now, joining us is Dr. Regi George to talk about the Tribal Health Initiative.
We came to Sittilingi, which was in the middle of the forested area, and the people here were very friendly. I don't think they believed that we were doctors who wanted to work here, because the only doctors they had seen were in the occasional films where they appear in suit and coat and tie and things like that. So when we came with our very earthy attire, I don't think they believed us that we were doctors, but they were very friendly and welcoming. And gradually over the years, they accepted us as doctors because they found that they could come to us with any illness and we could sort of cure them. So when we came here, we actually had no money. So we just took a piece of government land, encroached on it, literally. And the people here built us a small mud and thatch hut, which for the first 3 years was our hospital, where we did basic care, attended deliveries, did small amount of surgery and things like that, trying to help people. And then as our work, we approached funding agencies, we got some amount of money and we built a 10-bedded hospital. But even when we built that hospital, we were very clear that it should vibe with this area and tribals should not feel intimidated by coming to a large structure with marble and glass and all. So we have tried to keep it that way. We do all our buildings in a very sustainable way with soil cement blocks, and we have expanded from a small hut to a 35-bedded hospital with an operation theatre, an ICU and a labour room and neonatal care. And we are the only secondary care hospital in about 100 kilometers. So we have a large drainage area of more than 1 lakh people who utilize this hospital, most of which are tribals or deprived communities.
Tell us about the impact of the Tribal Health Initiative's work.
We take health to the people. So one of the best examples we can give you is about COVID and COVID vaccination, where we persuaded the government and took vaccines into the villages, into the farthest houses, and we got, I think we have done about 98% vaccination.
When we came here, there were mothers dying in childbirth, and then the infant mortality was 147, which was unlike the general Tamil Nadu statistics, no, which is Tamil Nadu being a developed state, even then, no, compared to many other states. But there were pockets like here, no, which had a worse, which had worse indices. We sat with them in a participatory training, you know, where we learned from each other, and they started working. They are all farmers, and they started working voluntarily in the village. And they looked at just three things. One is the nutrition, about nutrition and how to prevent malnutrition, or if it comes, know how to treat it, respiratory infections and diarrheal diseases. And these three put together were the major causes of infant mortality and under 5 mortality all over India. And they also looked at how to have safe deliveries. So these 4 things they looked after, and in a few years, in early 2000s, they brought down the infant mortality to 20 from 147. And this is not because of the hospital, not because of any of us, no, it is because of the community, the so-called not formally educated women from the community. If you have to improve the health of any community, then agriculture, you know, what we grow, what we eat, how nutritious it is, our livelihoods, our economy, our awareness about our rights, and how we go about it, and also the local governance, all these are major parts of health. So the community here, you know, what you see in Sittilingi is a collective effort of all the people here, how the community joined together and worked towards that health.
Dr. Regi George explain us more about the holistic approach that the Tribal Health Initiative has taken towards making the society self-sufficient.
So I think in the first 10 years we were concentrating mainly on bringing down mothers dying in childbirth and children dying before 5 years, which involved a lot of work with the community, empowering the community to know what are the problems and how to counter it. But after 10 years, when we had brought down our infant mortality and our maternal mortality, we were thinking that this is not enough. So we took a padayatra to all the villages we were working, sat down with the people, discussed with them, and said, what can we together do to help this situation? And there were many problems which came up. The biggest being farming, saying that farming is a loss and you have to help us with this. So we were talking about organic farming because we said it is good to make profits, but it is not at the cost of the earth and the insects and the animals. I know nobody believed us, and for the next 2 years we were only talking and nobody actually started doing organic farming. But after 2 years, about 4 farmers joined. We realized that through organic farming, we were able to persuade them to get into millets. And for us, millets is a big thing because we think that going back to traditional foods is the only way that a society can become nutritionally sufficient, nutritionally independent. And over the years, we have been able to mobilize that. I mean, we have been able to realize that. And I think most of the tribal families here have at least one meal of millet. We have not seen child malnutrition and adult malnutrition and anemia for a long time now, because I think the key was to change that diet. It took time. It took about, I think, 20 years to do that, but I think that was worth it because it's much better than any pill which you can give them. They're changing the habit of a population.
The Tribal Health Initiative has improved not only the health of the tribals, but also their financial status and community well-being. Whether training tribal women to deliver health to their community or forming a society of organic farmers, the couple has consistently strived to empower the tribal community that they chose to serve. That's it on the Banega Swasth India podcast this week. If you have comments, queries, or suggestions on the topic we discussed today, or issues you would like us to cover in future, write to us on bsipodcast@ndtv.com. Remember, BSI stands for Banega Swasth India. You can also connect with us on Banega Swasth India handles on Facebook, Twitter, and Instagram, and continue with the conversations through the week. Till next week, this is Ambika Singh Kama signing off. Stay healthy, stay safe.